Good evening. This is United Medical ACO Diabetes Program Wednesday Wellness Webinar. My name is Kemal Erkan. I'm the chairman of United Medical ACO. Today is June 8th, Wednesday. As always, second and fourth Wednesday of each month, we have diabetes events for our patients and for people who actually may be benefiting from these. Today, actually, sorry, there was a little technical issue. So I'm going to ask my teammates to introduce themselves. So Donna, we can start with you perhaps.
Sure. Good evening, everyone. My name is Donna Gunkel, and I'm the Director of Clinical Integration. So I oversee all of our clinical programs, as well as the care coordination, nurse teams, social workers, and dietitians.
And Amy?
My name is Amy Wilcoxon. I'm a dietitian and diabetes educator, and I help run the diabetes program with UMACO.
And then tonight we have Roxana Portlock, who's joining us first time, but she's been with us for a while as one of our social workers. So Roxana.
Hi, I'm Roxana. I am the licensed social worker for the behavioral health program, and I also research different programs for our clients as needed.
All right, thank you. So just so that if there are anyone who's watching this first time, so we do have other members in the program, Dr. Ripu Handal from First Aid Endo. He's our program director. And we have Tim McCoo, one of our physical therapists. So they are joining us time to time. So tonight we are going to talk about, with our panelists, Roxana and Amy, we are going to talk about resources for diabetes patients for food and medication assistance. So Roxana is as our social worker, she's part of our kids conferences, and we work on a daily basis very closely and in different patients these days. They do have different needs. Some they do want to better understand their issues, contracts, like what benefits they have, but some there are issues where we from the provider standpoint, we need to be more aware of what's happening with our patients in terms of the social determinant of health and understanding their situation better, and we can actually provide them what's available. And Roxana is working with us to make those communications easier and more efficient and more effective. So Roxana, before I go too far with this, I'll let you start.
Okay. There are so many resources out there. These were just a few that we picked up. The Food Bank of Delaware offer really good programs. They have a healthy eating, they have a seniors program, they have what they call a backpack program that's for children that's in school. They service the different schools in the area with lunches and breakfast, different meals. So, and 211 is a program that offers many resources, from help get food, transportation, housing, with your electric bills. They help you with all of your utilities. Okay, and then there's a single care. They are different programs that'll help get your medications, not only diabetes, but mental health. They help you get pressure medicine. It's a whole list of different things they'll help you with. Okay, next slide. Okay, now this is also the Food Bank of Delaware. They have different programs. They have their healthy pantry. They have the backpack program. They offer home deliveries for the patients that can't get out or that does not have transportation. They will make deliveries to 2 boxes a week to your home. You can call them, or you can go online and do an application, and they will make sure that they supply you with 2 boxes of food, a perishable and non-perishable. And they have fresh vegetables, they have herbs, they have whatever you want. You just fill out the form and that's what they will deliver. They have 2 delivery services. They partner with Amazon and DoorDash. There's no cost to the clients. They are also ask you not to tip because they're here to help, and there's many volunteers, and that's what they wanted to do with their time. So it's a great resource for or that can't get out and go grocery shopping and there's no one to go for them. So they just have to make a call or fill out an application. Okay, these are their numbers. These are their upcoming events. They do food drives in different areas. They work anywhere from Newark to Kings County and Suffolk counties. They have their numbers where you could always reach and find out where they're going to be in your area. So if they're not going to be in your, they still will make a way for you to come and get something to keep you from being hungry. Okay.
So we do actually share these events, upcoming events on our social media pages from United Medical and from our other practices. So those days should be available. Now, Roxana, with Food Bank, United Medical has a kind of partnership where we actually not only we do donate financially, but we also have volunteer services from our employees. So they do participate when we have the food delivery, food distribution. I think last one we did last month. So we are we work very closely with them. Now, I think your next one is with United 211. So this United 211 is not us. So this is
another resource, right? Yeah, it's just a resource. But before we go on, Kemal, I just wanted to say a little bit more about the food bank. So Kemal mentioned, and he very generously last year and this year donated to the food bank from United Medical so that they could host an additional 6 food banks within the 3 counties, Newcastle, Kent, and Sussex counties. Which is very important. And the other thing, like Roxana mentioned, is in addition to calling those 2 locations, you can also go onto the website and you can go under events, and pretty much they put them out there about a month in advance, because Roxana and I had looked out there several weeks ago and they only had them up through about June, not January, mid-June. And then we went back out there last week and they had added additional ones on. Again, you can usually find a couple each month in each county. Some of the primary locations, if you're in Kent County, for example, is usually at the Dover Speedway. They usually partner with either libraries or schools. So that they host them. And again, it is drive-through, and they do give a host of different items. I've worked at one of the food banks before, so usually you'll get like a bread item. You get, depending on how many members in your family, you either get usually 1 or 2 boxes of things that are like 2 boxes of things that are like dried powdered milk, canned goods, etc. Box of fresh produce. Usually there's milk, chicken. Now, if you don't have the means to keep some of that stuff, then they alter what they give you. So, for example, we had a few people that came up that didn't have a way to keep things cold, so they gave them more non-perishable items versus, the chicken and those kinds of things, the milk.
And this year we have 2 5Ks with Food Bank of Delaware. So hopefully we'll have more people participating in those events so that we can actually raise more money for a good cause. So now the United 211, that's I'm not so like I know we have partnership with them as well, but I'm not as familiar with their what's available from them. So here is United 211.
Mm-hmm. That's a state-run program. It has a variety of things that it can do with, like the people that's homeless can help you get a bed for the night. I believe they even do a hotel voucher, but 211 is like a host of partners that can help you with your needs. If you have a need with utilities, if you need to keep your electric on because you have medication there, they do. If you're hungry, they will. I was able to make an appointment for one of our clients to go to a food bank after hours and get something to eat and get some personal items. So they're out there to help, and they're in all the counties, and it's just a phone call away. You can just, whatever the need is, whether you're hungry or you need medications, they'll help you. Especially with the seniors also. They also help seniors with housing and getting to appointments. So 211 is just a good source.
And I think one of the other things to mention there with 211 is, again, you can call. Obviously, they have operators, but you can also go online. And as we demonstrated here in this screenshot, you can go out there to the website and there's a drop down menu. You can put in there what you're looking for. So for example, here we were looking for emergency food. You could list in there that you need a shelter or you need assistance with utilities. So again, it makes it, if you have the means to do that, it makes it a little bit easier for you. You can then, as you see down at the bottom, you can search by county, and then you can search by city. So really what it does is it helps narrow that search for you. So then you can find more information. Like we did the search here for the emergency food in Newcastle County and Bear, and it gave us a list. This is only a partial list of when they're open, how you go about getting it. Some places you have to make an appointment. Some places are only open certain hours, certain days. But again, it's just another resource, another way for you to be able to get what you need when you need it. Because sometimes the food drives are only, a couple of times a month, but most state service centers also offer pantries. Again, you have to call, or you can certainly reach out to our social workers, and they can assist you in getting food when you need it.
These are a few of the medication assistance programs, especially with the diabetes. Sometimes it's very hard if you need your insulin, if you have where you have to take it so many times a day, and it can be a little expensive. There's different pharmaceutical companies that will offer help with your diabetic medication, and this is just a few of them. There's a whole list. There's a whole variety of different ways medicine at a discounted price.
Now, the way that we access to this, is it part of the, so these are from the websites of these pharmaceutical companies, right?
Yes.
Okay.
Yes.
And
again, sorry, go ahead, Amy.
I was just going to say, I will add that if you can't afford a medication, obviously it's important to talk to your provider, but they can enroll you in these support programs. So some of them, like Lily often works with the endocrinologist. So you can just let the office know, and they can help you get set up.
And also with some of these, because Roxana and I were trying to, do a little bit more research on this, and some of them, when you click on the links, or if you go to that particular link, it will give you additional information of how to enroll and what the requirements are. Some of them, go by financial need and things of that nature. But again, as Amy mentioned, it's also good to be aware of what a particular insurance plan covers. And so if you're not sure, you can always call, or sometimes they can give you information, or they have online resources where you can find out what tier a particular medication is in, so you can find out what your copay or your out-of-pocket cost would be. So that's usually helpful.
I just went to Pfizer's link, and then there's a patient assistance. So this is what's available from their site. So then they can actually just go through the link and then see what's available.
Correct. And like Roxana said, there's usually an application there that patients have to fill out. And then sometimes it may just be basically subsidized. You may just get a reduced cost on it. Other times they may be able to provide it at no cost, but they vary based on the company.
Pretty easy to use. All right, so now
this is also a program where if you didn't have insurance, or your medication is costing you a lot, they have programs for brand name medications low as $69 a month. And it's really easy. You just call them, or you go to the website and they can go over it with you. They can let you know how much they can reduce your medication per month. This is Walmart's. Walmart's has a program where you can get different medications for $4 for a month, or $10 for 90 days. And they also have a medical card where they can also help you reduce the cost of your medication if you don't qualify for the $4 and $10 program. If you have insurance and it's still expensive, they have a medical card or coupon that you can use to help with the cost of medications. But they have a list on their website, or we also have it, that of all the different medications that you could get for $4 a month.
And
it's not
correct. Okay, go ahead.
I'm sorry.
Roxana, do you want to finish what you're saying before we both jump in?
You go. It's all right.
I was just going to say they do have a lot of really inexpensive medications, and they now also, I think as of last year, they carry their brand of rapid acting insulin, which is a big deal because it's very expensive. So that's something you can get at Walmart too for a lower cost. You need to talk to your endocrinologist about it. About if they can send it there and use that brand, but they do have lower cost insulin as well.
Mm-hmm.
Right. And I was going to say, so we just put a partial list here, but again, as Roxana was mentioning earlier, I mean, our focus tonight is of course on diabetes, but a lot of times our patients have multiple chronic conditions. So they may also have hypertension and some other chronic conditions. So there are also, again, it's not every medication. So we just want to make sure that everyone understands it's not every medication, but there are medications in every category, whether it's cardiovascular medications, like for your hypertension and other things, medications for if you have, gastrointestinal issues. So there's a multitude of medications out there. Really, you can just go to the website. And you can even Google it, and they have a whole list of medications in each category that fall into the $4 for 30 days or $10 for 90 days. And I think the other thing to note is, again, we didn't have time in this presentation to put all of them out there. We're just trying to let everyone know that there are a lot of resources in the community. I do believe CVS through Caremark, they also have a similar program where they have a list of medications that can be purchased on a 30 or 90-day time frame at a much reduced cost. So again, it's not every medication. So what we encourage you to do is to check with your pharmacy as well. Some pharmacies also have various different prescription cards that allow you to use that in conjunction with your insurance card, so that, again, it can reduce your out-of-pocket expense.
There is a list of different coupon websites where you can go on and they can give you, you could put in the type of medication and they can give you different resources of how to get the medication with different costs. And RX is one of them, and they offer a coupon that will help you with the cost of your medication. It's RX, it's Blank Health, Inside RX, and Single Care. That's just to name a few of them.
And sometimes when you're talking to your provider, sometimes they're aware as well, because one thing to note is a lot of the drug companies do have drug reps that go into the provider offices to make them aware of, you know, new medications that are coming on the market, changes in medications when generic medications come out, so that, again, generics usually a much lower cost than a brand name, but a lot of times they're very equivalent. And then often they provide the provider with different options, or sometimes coupons. Sometimes they know right there, or they might even have them in the office if they've been provided by the drug rep from that particular company.
And this one, it not only helps with medicine, medication, but it also helps with supplies. Like you may need your lancets or your needles. So they have partnered with different prescription companies or pharmaceutical companies that can help you get your medication and supplies at a lower rate. It's a nonprofit program. And this is also programs that will assist with medical supplies. I'm sorry, diabetic supplies, the glucose monitors and the needles.
Correct. So it's just, oops, if you could go back one, thank you, Kemal. So here again, it's important to check with your provider. Sometimes these supply companies for patients who may have trouble affording them, sometimes the companies may leave a few, especially at the endocrinology offices, they may leave a few of the glucose monitors there. Or again, like here, you can go to Abbott. They do also assist with providing free glucose monitors, and then they may offer discounts on getting the test strips. Kemal, you're on mute.
I'm not used to be on mute, so sorry. This was the last slide for for Roxana. So we'll have our second panelist, Amy. Now, with the stuff that we discussed, these are actually the first time we are discussing these in the diabetes event. So what I was, if we can talk to our web designer and add a page under United Medical Patient Resources, so it's easily accessible from there for like each section for the food and the supplies and the housing. So that would be an easy way to, and also it would be easier for Roxana to navigate that for the patient. So you can just refer them directly to the United Medical website.
Oh, great. That'd be awesome.
Yeah, I'll talk to John tomorrow.
Now, in many cases, what I was trying to say earlier, we don't know that these things are available. And until we had social workers working with us, we didn't know, honestly. And I think it's part of the great addition to what we did with our program is having social workers working with us while Roxana calls the patient's client. But when she says clients, those are our patients. It's not limited with what we do with the patients. It's not limited with just seeing them in the office and giving them the prescription or giving them the test. So it's the entire life of the patient is important. So that's, again, with the social determinant of health, what we learn every day is while we are trying to help them, while we are trying to provide the actual healthcare needs, there are barriers, certain barriers which are not helping those patients to understand and access to what we are providing them. So these are great additions to educate our providers, educate our patients, so they know what's available for them, so then they can complete their health and then they can better take care of themselves, hopefully.
Right. Yes.
All right, now I will go to Amy.
Thank you. So we just talked a little bit about diabetes is expensive. So it's when you find out that you have diabetes, sometimes it can seem very overwhelming that you have to make all of these changes. You have to buy healthy food, you have to start exercising, you have to take classes, and you need supplies, which Roxana just talked about. And then how are you going to afford all of this stuff? So Roxana just gave you some great tips on supplies and medicine. And so now we'll talk about exercise and healthy eating and also education and how to make that affordable. So if I could have the next slide, please. Thank you. So eating well on a budget. Roxana talked about food with the food bank, which is such a good resource. But then also some further tips for when you're shopping at the grocery store, and groceries are really expensive right now. The most expensive things at the grocery store typically are meat and dairy. So number 2 is beans. Canned tuna, eggs are cheaper than meat. So if those are things that you like to eat, those are things that I would look for in the store. Produce in season, if you can find a farmer's market, if there's somebody selling, trading, who's growing produce next month, or gross, you can get a packet of seeds for a couple dollars. You can watch our webinar of Kemal and Donna's gardens from last summer and grow some things in a pot or in your backyard. But canned and frozen are perfectly acceptable. We would rather that you eat canned and frozen vegetables than no vegetables, and they're certainly much, much cheaper. Convenience foods are convenient, but they're more expensive. So buying a bag of potatoes, a plain bag of rice is going to be cheaper than buying something like rice-a-roni, which seems cheaper because it's only a couple dollars in the box, but it doesn't have as much in it. Shop around if possible. The dollar store has food. You can buy a pouch of tuna. You can buy a pouch of salmon at the dollar store. You can buy milk at the dollar store. Aldi, Lidl, Walmart are probably some of the most affordable. If you're in Newark, the farmers market on Kirkwood Highway also has pretty good prices, as well as I haven't been, but from what I hear, the one in Newcastle also has pretty good prices too. There are food pantries in the area also. So besides the food bank, you can look up food pantries by your zip code. So sometimes churches have them. I don't know if I have them on my next slide or if they got taken into, if we could go back. I think they went in with the food bank resources. So if you look in your zip code, churches a lot of times have them. So with different Catholic Charities has a big group downtown in Wilmington, different churches, not far on Ots Chapel Road. There's one. Holy Family on Route 4 has a food pantry. So there's different ones in different areas besides going to a shelter or a someplace like Sunday Breakfast Mission. So use those if you need to.
And Amy, on the one slide, the 211, part of that search for like the emergency food, that's also what they had.
The food closets and the food pantries,
like
right? Okay. Yeah,
right.
I thought so. Yes, I knew it was there somewhere. Thank you. So shopping around if you can, and gas is expensive too. I know. So, going to these stores if you can, and then the food pantries for what you can't get. But it is absolutely possible to eat well on a budget. Some foods you might not enjoy canned green beans as much, but it may be the cheapest option. All right, so now if I could have the next slide, please. So education resources. Medicare covers 2 hours of nutrition with a dietitian every calendar year, 3 hours the first year you are diagnosed. So commercial insurance vary, but generally they most cover education, but that is certainly something that you can talk to your insurance companies about. So if this is something that is not available to you, or you can only get an hour and you can't afford more than that, watch all of our webinars. There's a link to our YouTube page. You can go back to the beginning from summer of 2020 and see what happens to your heart and your kidneys and your eyes and your feet, and exercise and mental health. And there's a lot more on there. Get a tour of ShopRite. So that can give you an idea of education. And if you could go to the next slide, please. And then if you want more, there are more free resources in the state. So the state of Delaware offers a 6-week diabetes class. If you go to the healthydelaware.org website, you can look at the different classes. And they don't offer classes for just diabetes. They also have heart health classes for people with hypertension and heart disease. The Cooperative Extension through the University of Delaware also offers a program called Dining with Diabetes. It's offered, there's one offered in Newcastle in the beginning of the year, and there's one, it's in Kent, and there's one in Sussex later in the year. So that is the website to go on to click to sign up for those. So there are some different resources in the state. And if I could have the next slide, please. Thank you. More state resources, the Delaware Diabetes Coalition. You click, there is their link there for DelawareDiabetesCoalition.org. So they give you information on different initiatives in the state. There are often classes, and now that things are starting to open back up, some of these classes are coming back in. For example, you can take a one-time free class at the library on cooking with diabetes. They're not going to cook in the library, but they're going to talk about cooking in the library. So there's different things you can talk about, shopping and budgeting. So the state offers all kinds of classes like this. There is a state conference usually in November in Dover for diabetes, and talking about all of the different things that come into play, and all of that is on their website. The last program is not actually for diabetes, it's for pre-diabetes. It's the diabetes prevention. And I apologize, I don't know why it says week. It's the diabetes prevention program, but it's not a week. It's 16 weeks, and somehow I left out the 16. So it is a national program, and it's based on a CDC study. So it's a study that was done quite some time ago now, where they compared metformin to diet and exercise, and they found that diet and exercise lowered A1C more than metformin. So they took basically what they did with diet and exercise, and it was made into a program in our area. The YMCA offers it. So you have to enroll, your doctor has to refer you, and you have to have pre-diabetes. So that's how your doctor has to get involved. But it's 16 weeks, but it's spread out over a year. And then with that, you get a membership to the gym. They talk about cooking. They have you keep with food logs. It's a low calorie, low fat diet. So that is something that gives people a lot of accountability. I have patients who I see while they're doing the prevention program, and they do very well having to meet with those weekly classes in addition to meeting with me. And that was my last slide. Thank you.
I wanted to just circle back for a second. So Amy, I know you were talking, I think on one of your education slides. So yes, we have all of those resources, but if you are seeing one of our providers, we do always encourage everyone to call their insurance company, as you mentioned, because I could have, the same insurance as Amy could, but if we had different plans, mine could offer, diabetes education and hers may not. So some plans do differ. We always encourage you to call. We can give you the code that would be billed. And then your insurance company would be able to let you know if it's covered, what your out-of-pocket expense would be, and to your point, how many hours, if there's a limit on how many hours. So we do encourage that. But if you do have any type of financial constraint and you are seeing one of our providers, we ask that you just reach out to us and we can talk to you on a one-on-one basis about what we may be able to do for you in order to help you to ensure that you get the education that you need from our dietitians.
So I do actually show our YouTube site. So any of our patients can go to, we do send these links to all of our patients. Either they get it from our patient portal or they may be getting it from our clinical database emails. So when you go there, everything that we do under Wednesday wellness webinar is already in one playlist. So there are 14 videos. We do keep them like with the new ones and old ones. So then now the reason I'm actually showing this, so Amy, you're going to allow this. So one of my friends, actually, let's say one of my friend's husband, so we won't give names, stopped by to the office, newly diagnosed with diabetes. And then every once in a while, like this is 7 to 8 p.m. Event, and we've been doing this for a long time. And so that like live, who's watching us live versus who may be watching us later on, if we are really reaching out to the people, we do wonder. And what he told me is that he watched the entire series that we have done as a newly diagnosed person, entire stuff that we did, and then I don't think they were trying to make me happy. Like they weren't saying these because they were trying to make me happy. But he said that he learned a lot more from here by watching them, and not like you don't have to watch the entire thing all together, but you can just watch them 2 episodes at one day, and you can just while you are doing gardening, you can watch. You can listen. They don't have to see us. Actually, they can just watch or listen to the event. I think there's a lot of useful stuff in there. So, and now we are getting more feedback, more responses from the patients, and we are utilizing these more because every session, every episode, we learn something new. So it's never ending. And I believe because of that, I think we are going to be able to help more people from the program standpoint. Now, one other thing that you mentioned, I was trying to get a picture, but no one is helping me today, so I'm on my own. Did get a picture of the garden. So I don't know why people wouldn't just do that on a regular basis, because I've been doing it in the last maybe 5-6 years, and I do it small. Like it's not. But what I see is if I was struggling or not being able to afford, it's